I've seen a lot of influencers in the last 12 months sharing their journey about removing their implants. Has that been something that you've seen in your practice here in Beverly Hills?
Absolutely. I do a tremendous amount of explants. I do a lot of augmentation, and some people do great and love their implants. So implants are not a bad thing, but they're not necessarily for everybody. Then there's patients who want their implants out for various reasons. A lot of times maybe they've just kind of done with it. They don't want it the size anymore. They want to be smaller. They've maybe had complications or issues with their implants, and they just don't want to keep going through operations. There's that subset of patients who have breast implant illness, who don't feel well because of the foreign body. Removing implants is not a simple thing because now the tissues have been stretched and damaged. And so there's a process to how you do that. Sure. A lot of surgeons don't really understand the best way to handle patients who want an explant. And a lot of times it's very important to remove the implant first so that the tissues can shrink and contract. Kind of like after you have a baby, the stomach will do that, but the breast do it at a much faster rate. So generally when somebody wants their implants removed, I'll take the implants out under a local anesthesia, just through a small incision under the breast. It's very easy to remove a silicone implant, or with saline, it's even easier. You just poke an IV into the implant and drain the saline, and you let the breast shrink for about a month or so. And then you can go back and do a much more accurate reconstruction where the patient can see what they look like, make sure they're okay with that smaller size. And if not, you can always put an implant back in.
Sure.
And it gives me much better quality tissues to work with. So it's kind of a win-win there. If you're not doing it at stage, you're probably not getting the best results possible with those kind of surgeries.